Hi there, and a very warm welcome to this explainer. Look, if you or a loved one has recently been diagnosed with an eye condition related to diabetes, I just want you to take a deep breath. It is completely natural to feel overwhelmed or even a little anxious right now, but you are in exactly the right place. Today, we're going right to the heart of a condition known as diabetic macular edema. Our main goal here? To totally demystify what's happening inside your eyes and swap out that anxiety for solid knowledge and empowerment. So, let's get started.
Now, this is often one of the most frightening questions newly diagnosed patients ask themselves. You might be looking at something simple like a door frame or a piece of lined paper, and suddenly those straight lines are curving or dipping. Maybe your vision is just blurry all of a sudden, or the letters look fragmented and kind of cut off when you try to read. I really want to validate that experience for you right now. It's scary and it's incredibly frustrating. But these changes, they aren't random. They're actually very specific signals from your eye telling us exactly what's going wrong.
So here is our roadmap for this explainer. 1. Your changing vision explained. 2. Fluid leaks and lipid spots. 3. Seeing inside, OCT scans. 4. Daily habits for eye health. 5. Conquering eye injection fears. And finally 6. Laser and surgical treatments. By the end of our time together, you're going to have a complete, totally manageable understanding of this condition.
Section 1. Your changing vision explained, making sense of the blur. You know, it is just so frustrating when the absolute center of your vision, the part you rely on to recognize faces, drive your car, and read, just stops focusing properly.
These are the hallmark disruptions that patients report. You might find it hard to bring objects into clear focus. Or maybe you notice dark spots, floaters, just drifting across your sight. You end up struggling with basic daily routines. And this happens because the fine vision center of your retina, which is that highly sensitive tissue at the very back of your eye, is unfortunately under attack from the systemic effects of diabetes.
So, let's break down the actual medical terminology, because that's crucial. The condition is called diabetic macular edema, or DME for short. The macula is just that precise, fine vision area at the back of the eye. And edema? That's simply the medical term for water gathering and causing swelling. Put it all together, and you've got swelling right in your sharpest zone of vision, caused by high blood sugar.
Section 2. Fluid leaks and lipid spots. What's happening inside? Okay, let's dive into this and look under the hood to see exactly why this swelling occurs in the first place. I want you to think of the blood vessels in your eye kind of like the plumbing in a house. When blood sugar stays too high for too long, it essentially rusts and damages those really delicate pipes. Over time, these weakened blood vessels begin to leak. Now, normally, your eye can handle a little extra fluid, but eventually, it's literally like a leaky pipe spilling water way faster than a drain can clear it. The retina just can't absorb the extra water, so it pools up right in the macula, creating that vision-distorting swelling we talked about.
But here's the thing, it's not just water leaking out of those pipes. Alongside the fluid, cholesterol and fats from your blood also escape. Doctors actually call these hard exudates. If you look at a scan, they show up as these bright yellow spots or circles right on the retina. These are dangerous intruders because if this fat and lipid buildup reaches the exact center of your vision, it can cause permanent damage and disturb your sight forever.
Moving on to Section 3. Seeing inside. OCT scans, revealing the hidden damage. This brings us to how your eye specialist actually sees all this hidden fluid and fat. Believe me, these diagnostic tools are about to become your best friends for visualizing and tracking your eye health.
What is truly fascinating here is the sheer scale of the swelling. A normal, healthy retina is incredibly thin, typically up to about 225 to 275 microns. I mean, that is microscopic. But when DME causes fluid to pool, that thickness increases dramatically. And this brilliantly illustrates exactly why your vision gets blurry. That precise, natural architecture of the retina just gets completely distorted and pushed out of shape.
To manage this, doctors rely on 2 vital scans. First, angiography. Think of this like a leak detector. It locates the exact weak points in the blood vessels where that fluid is escaping. The OCT scan, on the other hand, measures the actual depth of the puddle. It tells your doctor precisely how thick the swelling is, and honestly, most importantly, it monitors how well your treatments are working over time.
Section 4. Daily habits for eye health. Taking back control. Medical treatments are absolutely brilliant, but they're only half the battle. Let's shift gears and focus on how you can actively take back control of your vision from the inside out.
Your eyes don't exist in a vacuum, right? They're deeply connected to your overall systemic health. Obviously, strict blood sugar management is step one, but you also need to diligently monitor things like anemia, any bodily infections, your kidney health, and managing your high blood pressure. Controlling these systemic factors is a crucial daily habit, because think about it, if you don't control the pressure and the sugar in the pipes, the eye treatments alone simply cannot hold back the tide.
Section 5. Conquering eye injection fears, the painless reality. All right, let's address the elephant in the room. When patients are told they need an injection directly into their eye, it triggers intense fear and phobia. And let's be honest, that is a completely normal, natural human reaction.
But please, let this reassure you. Doctors perform this as a simple, routine daycare procedure. They use incredibly powerful numbing eye drops, so you literally do not feel any sharp pain. And the needle they use? It's a microscopic 30-gauge needle. In fact, as many specialists describe it, the actual sensation is just like a tiny mosquito bite. It sounds completely terrifying in your mind, but the physical reality is virtually painless and it's over incredibly fast.
So, there are two primary types of these painless injections. Anti-VEGF injections target and block the specific hormone that's causing the swelling in the first place, though those usually require repeat doses every 1 to 2 months. Then you have steroid implants, like Ozurdex. These release medicine slowly over 3 to 4 months, and they are highly effective at breaking down those dangerous yellow cholesterol deposits we talked about earlier. Your doctor is going to choose the right one based on your specific OCT scan and your overall health.
Section 6. Laser and surgical treatments. Exploring all options. Let's look at how this builds out our final medical arsenal. Because sometimes injections just aren't enough, or maybe a patient's phobia of needles is simply too severe.
Taking a bird's eye view of your options here, we've covered injections, which are the primary tool for controlling swelling, but if you have a really severe needle phobia or some stubborn lipid accumulations, focal or grid laser therapy is a highly effective alternative that doctors still rely on today. And finally, if there's an actual physical pulling on the retina, which is a condition called vitreomacular traction, well, that's when surgery is required.
That surgical option is called micro-incision vitrectomy surgery, or MIVS. See, sometimes a physical membrane or jelly forms and quite literally pulls on that delicate retina. It keeps the swelling going no matter what medications you use. So surgery is necessary to step in, remove that jelly, and release all that harmful tension. Once that's gone, the retina can finally lay flat and heal properly.
And see that number right there, 45 to 60? That is how many minutes this surgery typically takes. It's just another painless, routine daycare procedure. You aren't staying in a hospital bed for days. You're in and out, with your vision gradually recovering over the next 2 to 3 weeks. Modern medicine has truly made dealing with these complications remarkably efficient.
Now, diabetic macular edema is indeed the most common cause of vision loss in diabetes. But as we've seen today, between strict systemic daily habits, those incredibly precise OCT scans, and all the painless modern treatments, from targeted injections to rapid surgeries, you absolutely have the tools to fight back. The power to protect your vision is right in your hands and in your daily choices. So I'll leave you with this thought. Knowing what you know now, are you ready to step up and take total control of your eye health today? Thank you so much for learning with us.